Welcome to exam practice video. In this video, we will go through all the model question types like extended multiple response, case studies, highlighting, drag and drop, close, figure, matrix, and others that you should be expecting in the new next generation Nclex art and examination. Be sure to have a notebook handy to gauge your own readiness as we go. I'll guide you through each option in detail, explaining what makes an answer correct or incorrect to help you think critically. And if you need to review any part, feel free to pause or rewind, especially for those case study questions. Let's dive in and get you ready. A 35-year-old patient presents with an irregular heart rate. Upon evaluation, the patient's ECG shows a lack of P waves and a chaotic rhythm. What is the likely diagnosis for this patient based on their ECG findings? A. Sinus bradycardia. B. Atrial fibrillation. C. Supraventricular tachycardia. D. Ventricular fibrillation. The correct option is B. Atrial fibrillation. The patient's ECG shows a chaotic rhythm with no identifiable P waves, which is indicative of atrial fibrillation. In atrial fibrillation, the SA node fails to pace the heart and impulses are coming from the AV node, resulting in abnormal P waves and a chaotic rhythm. Option A is incorrect as sinus bradycardia presents with a regular rhythm and a heart rate less than 60 beats p.m. Option C is incorrect as supraventricular tachycardia presents with a regular rhythm and a heart rate greater than 120 beats/m. Option D is incorrect as ventricular fibrillation presents with no pulse or QRS and a chaotic rhythm, while the patient's ECG shows a chaotic rhythm but with a normal QRS. A 65-year-old patient with a history of diabetes and hypertension is admitted to the hospital with signs of a myocardial infarction. The healthcare provider has prescribed medications and management interventions. Match each drug and intervention to its appropriate nursing action. The table is given to you. Matrix-type questions on the Nclex exam challenge you to evaluate multiple related concepts within a single question. You'll be required to match answers across a grid or table, testing your ability to assess, prioritize, and integrate knowledge to make sound clinical decisions. Let us see the rationale for the choosing correct options in the table. First, let's see for aspirin. Monitor for bleeding. Aspirin is an antiplatelet agent that increases the risk of bleeding. Monitoring for signs of bleeding is critical. Aspirin does not directly require BP or blood sugar monitoring, and administering with food is not necessary unless to reduce gastrointestinal discomfort. While not strictly necessary, administering aspirin with food can help reduce the risk of gastrointestinal upset. Let's now see for insulin. Check blood sugar. Insulin is used to regulate blood sugar levels, so blood glucose monitoring is essential. Insulin does not require direct BP or bleeding monitoring, and administering with food is not necessary unless treating hypoglycemia. However, insulin administration is sometimes recommended with food, especially in cases of rapid-acting insulin, to ensure the blood glucose levels do not drop too low. Let's see for beta blocker. Monitor blood pressure. Beta blockers lower blood pressure and heart rate, so BP monitoring is required. Beta blockers do not cause bleeding or require monitoring for it. Heparin. Monitor for bleeding. Heparin is an anticoagulant that increases the risk of bleeding. Monitoring for signs of bleeding is critical. Heparin is administered subcutaneously or intravenously and does not require food for administration. Let's solve a practice question out of all that we studied recently. I will give you some time to go through the question. Please do not forget to check out the timer. If you need more time, please pause the video and I will check your answers in the comments section. Please write the name of topic and the option number that you feel is the right answer in the comments section. A 42-year-old male is brought to the emergency department after a motorcycle accident. He is unconscious and has a visible head injury with blood coming from his ears. Paramedics report that his breathing is labored and his pulse is weak. His GCS score on arrival is 8. The trauma team needs to prioritize interventions to stabilize his condition. Based on the Glasgow Coma Scale, GCS, score, what should be the first priority in this patient's management? The options given to you on the screen are Option A, immediate airway management and ventilation. Option B, stabilizing his blood pressure and controlling bleeding. Option C, performing a neurological assessment to check for signs of a stroke. Option D, administering pain medication and calming the patient. Let me reveal the right answer of this question. You can pause the video if you need more time to understand the question again. The correct answer is Option A, immediate airway management and ventilation. A GCS score of 8 indicates that the patient is in a severe state of consciousness impairment. A score of 8 or lower is considered a coma. This requires immediate attention to airway and breathing to prevent respiratory failure and further neurological damage. In patients with low GCS, airway management, intubation if necessary, is a priority to ensure proper oxygenation and ventilation, as their ability to maintain a clear airway may be compromised. Option B, stabilizing his blood pressure and controlling bleeding is partially correct, but secondary priority. While stabilizing blood pressure and controlling bleeding are important in a patient with a GCS score of 8, ensuring adequate airway and ventilation is more critical. Hemorrhage control and blood pressure management are also important, but are secondary to ensuring oxygenation and preventing further brain injury. Option C, performing a neurological assessment to check for signs of a stroke is incorrect. Although neurological assessment is important in evaluating a patient's condition, the priority in a GCS8 patient is airway management. A detailed neurological exam, such as assessing for stroke, may follow once the patient's airway is secured and breathing is stabilized. At a GCS of 8, the patient is unconscious, and performing a stroke assessment is not the immediate priority. Option D, administering pain medication and calming the patient is incorrect. Pain management is important for patient comfort, but it is not the first priority in this case. The patient is unconscious, and sedating him further with pain medications could compromise his airway. The immediate priority is airway protection and ensuring adequate ventilation. So the key takeaway from this video is, in cases of altered consciousness, for example, low GCS, airway management is the most immediate concern. Once the airway is secured and the patient's respiratory status is stabilized, attention can be turned to addressing other life-threatening conditions, including bleeding, shock, and further neurological assessment. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the Nclex RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to Nclex RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the Nclex. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this. The 65-year-old male patient was admitted with symptoms of shortness of breath, cough, and wheezing. His medical history includes smoking and asthma, which likely contribute to his current respiratory issues. Upon examination, the patient displayed noticeable difficulty in breathing and audible wheezing. The chest sounds were described as congested, with the presence of both wheezing and crackles. His vital signs revealed an elevated pulse rate of 120 beats per minute and low blood pressure of 90 by 60 mmHg. Additionally, his oxygen saturation was recorded at 88% while on room air, indicating inadequate oxygen levels. In the nurse's notes, it was observed that the patient exhibited significant shortness of breath and wheezing, which are consistent with acute exacerbations of asthma or potential chronic obstructive pulmonary disease. The congested chest sounds with wheezing and crackles suggest an accumulation of mucus or other obstructions in the airways. The elevated pulse rate and low blood pressure may be indicative of the patient's distress or possible underlying cardiac issues. The reduced oxygen saturation level further confirms a deficiency in the patient's oxygenation status. The physician has ordered several diagnostic tests and treatments to address the patient's condition. An arterial blood gas test is to be performed to assess the patient's acid-base balance and respiratory function. A chest X-ray will be conducted to evaluate the condition of the lungs and identify any possible pathological changes. Spirometry is ordered to measure lung function and determine the extent of airway obstruction. In addition, nebulization and bronchodilators are prescribed to alleviate the wheezing and shortness of breath by opening up the airways and improving airflow. The lab results from the arterial blood gas test reveal a pH of 7.25, indicating a state of acidosis. The partial pressure of carbon dioxide is 50 meters mHg, which is elevated, suggesting respiratory acidosis. The bicarbonate level is 20 milliequivalent per liter, which is slightly low, reflecting a possible metabolic component contributing to the acid-base imbalance. The oxygen saturation remains at 88%, highlighting ongoing hypoxemia despite the interventions. These findings guide the physician and nursing team in tailoring the appropriate treatment to stabilize the patient's condition and address the underlying causes of his respiratory distress. What condition does the patient have based on the arterial blood gas test results? The options for this question given in the screen are: Option A, respiratory acidosis. Option B, respiratory alkalosis. Option C, metabolic acidosis. Option D, metabolic alkalosis. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, or respiratory acidosis. The patient's arterial blood gas test results show a low of 7.25, which indicates acidosis. The elevated partial pressure of carbon dioxide of 50 millimeters of mercury suggests that the acidosis is caused by decreased ventilation. The bicarbonate levels are below the normal range, which shows that the body is compensating for the acidosis. The oxygen saturation is also below normal, supporting the respiratory acidosis diagnosis. The patient's history of smoking and asthma further supports the diagnosis. This question was pretty easy. Let me take you to our next question. What is the most likely diagnosis for the 65-year-old male patient based on the given information? The options for this question given in the screen are: Option A, chronic obstructive pulmonary disease. Option B, bronchitis. Option C, pneumonia. Option D, acute respiratory distress syndrome. Option E, asthma exacerbation. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. right, time's up. Let me reveal the right answer to you. The right answer is option A, or chronic obstructive pulmonary disease, and option E, or asthma exacerbation, are the correct answers. Option A, chronic obstructive pulmonary disease, is a likely diagnosis based on the patient's history of smoking and asthma, symptoms of shortness of breath, wheezing and cough, chest sounds congested with wheezing and crackles, and elevated pulse rate. Option B, bronchitis, is not a likely diagnosis as the patient's symptoms, such as shortness of breath, elevated pulse rate, and low blood pressure, suggest a more severe condition than just bronchitis. Option C, pneumonia, is not a likely diagnosis as the patient's chest sounds congested with wheezing and crackles, which is not a typical sign of pneumonia. Option D, acute respiratory distress syndrome, is not a likely diagnosis as the patient's arterial blood gas results do not meet the criteria for a RDS. Option E, asthma exacerbation, is a correct answer as the patient has a history of asthma and is showing symptoms of wheezing and shortness of breath. The physician's order of nebulization and bronchodilators also supports this diagnosis. This question was pretty easy. Let me take you to our next question. What is the primary cause of respiratory acidosis? The options for this question given in the screen are Option A, hypoventilation. Option B, pneumonia. Option C, brain trauma. Option D, emphysema. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, hypoventilation. Respiratory acidosis is caused by hypoventilation, which is when the lungs cannot exchange carbon dioxide with the environment due to airway or ventilation obstruction. This causes the excess carbon dioxide to combine with water to form carbonic acid, leading to an increase in hydrogen ions in the blood and a drop in the pit level. Other conditions such as pneumonia, brain trauma, and emphysema can also cause respiratory acidosis, but hypoventilation is the primary cause. This question was pretty easy. Let me take you to our next question. What could be the clinical manifestations of respiratory acidosis? The options for this question given in the screen are Option A, seizures, warm and flushed skin, and decreased blood pressure. Option B, drowsy and dizzy, headache, and coma. Option C, tetany, numbness, and seizures. Option D, deep and rapid respiration. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. Answer B, drowsy and dizzy, headache, and coma. The clinical manifestations of respiratory acidosis are related to the increase of carbonic acid in the blood, leading to hypoventilation. The compensatory mechanism of the kidneys retaining bicarbonate and excreting excess hydrogen ion can cause the patient to feel drowsy and dizzy, have a headache, and even go into a coma. Seizures, warm and flushed skin, and decreased blood pressure are also symptoms, but not specific to respiratory acidosis. Tetany, numbness, and seizures are the symptoms of respiratory alkalosis. Deep and rapid respiration is the symptom of metabolic acidosis. This question was pretty easy. Let me take you to our next question. What is the main cause of metabolic alkalosis? The options for this question given in the screen are A, excessive diarrhea, B, diabetic ketoacidosis, C, excessive vomiting, D, kidney disease. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you If you're watching this video and feeling the pressure of tackling those challenging Nclex RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from Nclex RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their Nclex on the first try, and now you can benefit from their expertise too. So if you're ready to boost your confidence, master those case studies, and head into your Nclex exam prepared like never before, the Nclex RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. You can pause the video as well. The main cause of metabolic alkalosis is C. excessive vomiting. This occurs due to the loss of acid through increased bicarbonate ion concentration in the blood. Other causes include diuretics and citrate toxicity during massive transfusion of whole blood. This question was pretty easy. Let me take you to our next question. If the condition is caused by excessive vomiting that leads to increase in bicarbonate ion concentration in blood, what is the condition? The options for this question given in the screen are: Option A, respiratory alkalosis. Option B, respiratory acidosis. Option C, metabolic acidosis. Option D, metabolic alkalosis. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. Correct answer, D. Metabolic alkalosis. Metabolic alkalosis is the condition caused by excessive vomiting that leads to increase in bicarbonate ion concentration in blood. This increase in bicarbonate ion concentration leads to loss of acid in the blood and results in metabolic alkalosis. Other causes of metabolic alkalosis include diuretics and citrate toxicity during massive transfusion of whole blood. This question was pretty easy. Let me take you to our next question. Ms. Carter, a 62-year-old patient with a history of chronic obstructive pulmonary disease, is admitted to the hospital with worsening shortness of breath and fatigue. She reports a productive cough with greenish sputum for the past 3 days. On assessment, her vital signs are as follows: temperature 101.3 degrees, respiratory rate 28 breaths per minute, heart rate 102 beats per minute, blood pressure 135 by 88 mmHg, and oxygen saturation of 88% on room air. She appears anxious and auscultation reveals wheezing and crackles in the lower lung fields. Arterial blood gas, ABG, results show pH 7.31, PaCO2 58 mmHg, PaO2 65 mmHg, and HCO 330 milliequivalent per liter. Highlight the clinical findings that indicate Ms. Carter's respiratory status is compromised and requires immediate intervention. Let's see the correct selections to highlight. Oxygen saturation of 88% on room air. Indicates hypoxemia, requiring supplemental oxygen to improve oxygenation. Arterial blood gas pH of 7.31 and PaCO2 of 58 mmHg. Reflex respiratory acidosis due to CO2 retention, a hallmark of COPD exacerbation. Wheezing and crackles in the lower lung fields. Suggests airway obstruction and possible infection or fluid buildup, requiring prompt management. Temperature of 101.3 degrees. Indicates a potential respiratory infection, for example, pneumonia, exacerbating COPD symptoms. Let's see highlighting of those options which would be wrong in case we highlight. Blood pressure of 135 by 88 mmHg. Slightly elevated but not immediately concerning or related to respiratory compromise. Heart rate of 102 beats per minute. Mild tachycardia, likely secondary to anxiety or hypoxemia, but not a primary focus for intervention. Mrs. Kapoor, a 68-year-old female patient, has been diagnosed with chronic conditions such as congestive heart failure, CHF, high cholesterol, and osteoarthritis. She is taking several medications to manage these conditions. She needs clarification on how to properly take her medications to avoid side effects and ensure optimal treatment. Mrs. Kapoor is prescribed the following medications. 1. Furosemide, a diuretic for managing fluid retention due to CHF. 2. Atorvastatin, a statin to control her cholesterol levels. 3. Acetaminophen, a pain reliever for osteoarthritis pain management. Match the nursing advice with the appropriate medication Mrs. Kapoor is taking. The options given on the screen are Option 1, furosemide. Option 2, atorvastatin. Option 3, acetaminophen. The corresponding nursing advice to be matched dragging are A. Take this medication with a full glass of water and monitor for signs of dehydration, such as dry mouth or dizziness. B. Take this medication at bedtime to reduce the risk of muscle pain and injury and avoid drinking alcohol. C. Take this medication with or without food and avoid exceeding the recommended dose to prevent liver damage. This sequence of nursing advice ensures safe and effective management of Mrs. Kapoor's medications. Furosemide, Option 1, is a diuretic that can cause dehydration, so it is important to take it with plenty of water and monitor for signs of dehydration. Advice A. Atorvastatin, Option 2, is best taken at night and should be taken with caution due to the risk of muscle pain, myopathy. Avoiding alcohol can prevent exacerbating muscle issues. Advice B. Acetaminophen, Option 3, can be taken with or without food, but it is important not to exceed the recommended dose to prevent liver toxicity. Advice C. Mr. Miranda, a 67-year-old patient, has been admitted to the hospital for treatment of pneumonia. Due to difficulty swallowing, he has a nasogastric tube in place for medication administration. The healthcare provider has ordered the administration of a crushed medication via the nasogastric tube. The nurse prepares to administer the medication. Fill in the blanks question. The options given to you in the screen are: before instilling the medication, the nurse should check the and here is a blank space for you to fill and followed by another space, contents. Option A, respiratory rate and oxygen saturation. Option B, tube placement and residual. Option C, blood pressure and heart rate. Option D, temperature and weight. I will give you some time to think for the answers. The timer runs in the top right corner of the screen. In any case, if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is option B. Option A, checking the respiratory rate and oxygen saturation is important for monitoring the patient's respiratory status, but is not related to administering medication via a nasogastric tube. Option B, this is the correct answer. Before instilling the medication, the nurse should check the tube placement and residual contents to ensure that the medication is being administered to the correct location and to prevent complications such as aspiration. Option C, checking the blood pressure and heart rate is important for monitoring the patient's cardiovascular status, but is not related to administering medication via a nasogastric tube. Option D, checking the temperature and weight is important for monitoring the patient's overall health status, but is not related to administering medication via a nasogastric tube. A 45-year-old patient with severe malnutrition is admitted to the hospital. Based on Maslow's hierarchy of needs, which of the following is the correct order of actions the nurse should take to prioritize care? The options given to you on the screen are: Option A, start by discussing the patient's personal goals and growth, then focus on building the patient's confidence, followed by family involvement, ensuring safety, and finally addressing nutrition. Option B, first stabilize the patient's nutrition, then ensure safety in the environment, followed by involving the family, encouraging physical activities to boost confidence, and eventually discussing long-term personal growth. Option C, begin by involving the family, then ensure the patient's safety, focus on self-actualization, and finally address nutrition and physical activities. Option D, prioritize the patient's confidence and self-actualization, then address safety, nutrition, and family involvement. Let me reveal the answer to this question. You can pause the video and try to guess the answer. The correct answer is option B. First stabilize the patient's nutrition, then ensure safety in the environment, followed by involving the family, encouraging physical activities to boost confidence, and eventually discussing long-term personal growth. Option A, start by discussing the patient's personal goals and growth, then focus on building the patient's confidence, followed by family involvement, ensuring safety, and finally addressing nutrition. This is wrong because self-actualization, or personal goals, should only be addressed after physiological or nutrition and safety needs are met. Focusing on personal growth too early neglects basic survival needs. Option B, first stabilize the patient's nutrition, then ensure safety in the environment, followed by involving the family, encouraging physical activities to boost confidence, and eventually discussing long-term personal growth. This is the correct order. Nutrition comes first, which is physiological needs, followed by safety, social needs with his family, esteem needs or confidence, and then self-actualization or personal growth, as per Maslow's hierarchy. Option C, begin by involving the family, then ensure the patient's safety, focus on self-actualization, and finally address nutrition and physical activities. This is wrong because family involvement and self-actualization should come after addressing basic nutrition and safety needs. Ignoring survival needs puts the patient at risk. Option D, prioritize the patient's confidence and self-actualization, then address safety, nutrition, and family involvement. This is wrong because esteem and self-actualization should not be prioritized over nutrition and safety, which are basic survival needs. B is correct because it follows the proper order: nutrition, safety, family involvement, confidence, and then personal growth.